Yeah. We're preparing, setting up the meeting. Good evening, everyone.
Good evening.
Welcome to Medical Mondays with Dr. O. We're thankful that the weather is nice today, or nicer in Maryland. But we were expecting snow tomorrow, I heard. Anyways, today is Medical Mondays with Dr. O, and we are here again to learn, to enrich ourselves, and to get better and stronger health. We're thankful to have one of our own sons of the soil, Dr. Olu Omowole Ajagbe. I just like to call him Dr. Ajagbe, but he's going to talk to us about dental care and dental health again today. Today is important to talk about this because February is dental dental health month. It's also Black History Month. So be prepared to hear something on our Black history before the month is over. It's also Cardiovascular Health Month. And it is the month for several things. I was shocked that the few weeks we have in February is the month for this, for this, for that. But we will address those three things this month that the month emphasizes. So we're starting with the dental healthcare, and there's no better person to educate us more than Dr. Ajagbe. So Dr. Ajagbe, welcome, sir. And so the floor is yours.
Thank you, Dr. O. We all commiserate with you as you transition through this period of grief and closure. And we just thank you for making yourself available for this type of program rather than sulking, but you are here to enrich the community. We applaud you and we want to say thank you for that. It's a pleasure again to come before the group tonight to share some things. Um, just as an icebreaker, let me just ask, how many people know the awareness observances? How many of them that we have in February? Does anybody know? You probably don't know, but at least there are 9 different observances. And I think out of the 9, 4 of them are related to health. And if you are interested later on, I can share a copy with you. But anyway, as Dr. O mentioned, February is National Black History Month. It's also National Children's Dental Health Month, as well as the Heart Health Month. So we want to see a way to kind of integrate all of these, different observances to make February Medical Mondays with Dr. O seemingly, not compliant, but at least relevant to the observances that are on for February as a month. So when we talk about the um, dental, National Children's Dental Health Month, we cannot start by just going into that without talking about some history. And so this evening, I'll be going through the topic as captioned "Healthy Smiles, Bright Futures." And that is because the focus would have been primarily on children, that we will kind of tie everything together, a little bit of history, a little bit of children's focused dental care, as well as, overall health of Americans or everyone that is hearing my voice. So let's start by just going through the few slides that I have set for us. The slides are pretty much pointers or prompters in order for you to be able to follow as I go step by step. In the end, you can refer to the take home message that has been circulated. I believe you will have received a copy of the take home message with the invitation to this program today. All right, this is going to be a short journey through the history of dental health care, Black pioneers in dentistry, children's dental health, insurance coverage, and policy shaping the care in America. So if we follow systematically, we'll know that organized dentistry just didn't happen. It started gradually, and I will go over that in a few seconds. Um, like any other developing country, the early dentistry focused primarily on tooth extraction and pain relief, because most of the time when people had toothache was one of the worst pains anybody can experience in their lifetime. And the only solution for most patients is to have the tooth taken out. Once the tooth is taken out, the pain will subside over time and the patient will feel relieved. But by the 19th century, there are advancements that led to organized dental education and licensing. Um, the American Dental Association, the ADA, you know, is another ADA because there are quite a few ADA that are, when you do ADA search, you will get many organizations, not just American Dental Association. But the American Dental Association that governs, the affairs of dental practice, the standard of dental care, actually started in 1859. That was a long time ago. Um, but soon afterwards, the programs by the federal government began to improve access to dental care because in the earlier part of the development of dentistry, only those who can afford, care did get some care. Many people were relieving their pains using alcohol, just swigging alcohol to calm down the toothache. I'm sure you know that in Africa as well, many people who don't have access to care will use home remedies like anything they know that can relieve their pain. So the same thing was here in America many, many years ago. So, in order to improve access to dental care, the federal government began to implement some federal programs which trickled into state as well as local governments of the territories in America. So, by looking back, before you can talk about organized dentistry, you will have to think about a system in place that allows individuals to go through systematic training, professional training in order to become dental surgeons. So, the very first dental school in America, I'm sure many of you would not have guessed it. If I asked you, which dental school do you think is the oldest? Many people would never think about University of Baltimore Dental School. That is the first in the United States of America. It was established in 1840. Harvard did not start until about 27 years after the one in Baltimore. So, so you can see that most of the dental, you know, um, organizations and the dental institutions were actually in the Mid-Atlantic region of America. I guess that's because that's where the first settlers seem to have settled, and that's where most of the educational centers began to spring up. And so we see the next one will be Pennsylvania College of Dental Surgery, followed by New York College of Dentistry. And these were among the earliest set of dental, educational programs in America. So you see, these schools, particularly the one in Baltimore, seems to set the foundation for modern dentistry and professional standards. So, people living in Maryland, you are blessed to have access to places like University of Maryland, Baltimore campus, where the College of Dentistry is. It is best to visit at one point in one's lifetime if you live in Maryland, just to see where this whole thing started. So, during the time that Baltimore, Harvard, Pennsylvania, New York, and other institutions were forming, there was a big time segregation. So many African Americans had no access to such places, first because of race, and then because of cost. In many cases, they would not be able to afford that kind of education. So, in the history of America, there came a time when the historically black institutions or black colleges and universities were formed. And the first two that actually, the only two that have dental program, are Howard University College of Dentistry, which was established in 1881. That was 41 years after Baltimore had existed. That's a long gap between them. Meharry Dental, Medical College, School of Dentistry was established in 1886, which was 5 years after Howard University College of Dentistry was established. So these institutions have been vital in increasing the representations and improving access to care in underserved communities. The graduates from HBCU dental schools continue to be leaders in dental research, public health, and education. Well, I I cannot shy away from that because I was part of that HBCU program at Howard. I was there for about 24 years, and having been an educator in an historically black college and university of a stature like College of Dentistry in Howard University, I can tell you of a fact that there is a high level of quality of training because many times when we hear about black institutions, some people just thump their noses at it like, what do you think they are teaching them there? If you look into the annals of dentistry, you will be surprised. You'll be pleasantly surprised to find a lot of Howard trained, graduates, and some of us that didn't train at Howard, but worked at Howard, instilled a lot of discipline and as well as educational quality to the students that we served during my time in Howard. There are some notable, pioneers, black pioneers in dental healthcare. I will just name a few of them, and many of them were black. Many of them were mixed, colored, and they played very critical role in advancing oral healthcare despite facing segregation. Um, they advocated for equitable access to dental care in underserved Black communities, and they pioneered innovations in prosthodontics, oral health advocacy, and education. Here are some of the notable Black dentists, since we are talking about Black History Month. Dr. Robert Tanner Freeman was the very first Black dentist in the United States of America. He trained in Harvard and graduated in 1869. Dr. Ida Gray Nelson Rollins, first Black female dentist in the United States, graduated in 1890. Dr. George F. Grant, also Harvard professor and prosthodontist, was an expert that even the presidential, staff will consult regarding the health or replacement of teeth in the presidents of those times. Dr. Annie Elizabeth Delany was an advocate for racial equality and oral health access. So these are people whose names stand out, in the annals of the history of dentistry in America. What are some of the roles of Black, dental organizations? The dental organizations that are commonly recognized, the biggest of them all is the National Dental Association, the NDA. It was established in 1913 to support Black dental professionals because ADA, as of that time, was also practicing a form of segregation, and they were not fully representing the African American, Black dental professionals at that time. Howard University and Meharry Medical College, both dental educations, were very, very important in raising the population of Black dentists in America as well as all over the world. Community-based programs improving access to dental care in underserved populations were also championed in these two institutions. I was part of the first round of Robert Wood Johnson Foundation and Kellogg grants that was developed to actually create a pipeline for dental professionals. In which case, the grant was supposed to prepare children from elementary school to increase their awareness and interest in dental programs through high school, through their first degree, and then eventually being encouraged to become dental students, eventually becoming dental professionals. And that has become very successful. And that was the last project I was part of before I left academia. So let's come to the one at hand. The one at hand now is the National Children's Dental Health Month. That also has its own short history. The American Dental Association launched this program just to increase awareness about, children's dental health. It was established or convened in 1941, and it was supposed to be just for one day. But for every year, they will spend 1 day to to observe children's dental health. And so after about 14 years, the program increased or expanded to a week-long observance because there are more, people that are, becoming more aware of the need for dental care to be championed in children. And so the observance became 1 week long. And a few years later, about 26 years later, it became a national a month-long observance to acknowledge the need to focus on children's dental health care. So the initiative promotes awareness of pediatric oral health and encourages good dental habits from early age. So children dental health in America. So the National Children's Dental Health Month raises awareness of early oral care, cavities. We know that cavities and gum diseases are still major issues in every age, but we know that cavity remains the most common chronic disease among children. And the reason for this is, home health care. How well do they clean their teeth? Do they clean their teeth on a regular basis? Many of them don't even comply without the parental supervision. So we know definitely without flossing, without regular cleaning of their teeth, they will eventually develop cavities. And because baby teeth are much weaker than adult teeth, they are more likely to have multiple decayed teeth at the same time. So this increases the suffering and discomfort of these children, and that is one of the reasons why this thing, this national awareness on children's dental health in America has become very, very important. Poor oral health, we know, affects nutrition, affects speech development, and affects academic performance. In fact, it affects the self-esteem of the individual, the child. So we need to prevent and show early interventions to ensure lifelong oral health. So one of the things that we must focus on in children is preventive dental care. We already know simple things like brushing twice a day with fluoride paste. We will talk about some other downside of some of the things that are listed here, but these are standard things that ADA sanctions. ADA approves these preventive measures, but as we look into research, recent research data, we can see that some of these things are not really as effective or as beneficial as they seem. So, brushing twice is definitely important. What we use to brush the teeth may be scrutinized because there are situations, there are literature that seem to oppose some of these additives that are in the toothpaste in terms of overall health. Dental flossing to remove plaque and food particles between teeth is imperative. Reducing sugary snacks and drinks to prevent cavities. That is already known by almost everybody because everyone will say, "Why do you have so many cavities in your teeth?" Say, "I love to eat sugar. I love to eat candies." So we all know there's direct correlation between sugary snacks and drinks, as well in correlation to cavity formation. So regular checkups and professional cleaning are also necessary because when you go for a dental checkup, the dentist has the opportunity to identify what's going on and be able to attract your attention to it. And once you know it, particularly for children under our care, we can then begin to be more proactive than be waiting until the child is unable to sleep at night and we're looking for emergency intervention. So
Dr.
apply,
Jagbe, sorry
yes,
for interrupting you. Are you sharing?
yes.
Okay, I don't know. Can anybody see it? Because I can't see it. I don't know if that's just me.
I'm seeing it.
Oh, okay.
Can,
Then
any,
it's
can
me.
anybody else see it?
Yeah, I can see clearly.
Yes,
Okay,
yeah,
then
I
it's
can
me
see.
then. Sorry, go ahead. Sorry. Then
Okay, so but Dr. Jagbe, I don't know what you did to, your the pointer, because as Sister Wumi was speaking, it was
Mhm.
where the pointer should be was her, and I have been there all this time. I'm trying to remove me. I don't know. But I see that when you move the pointer, my screen moves.
Well, I guess it's because I'm the one sharing the screen. So
Okay.
anything that is moving on my side will show on your screen as moving.
No, it's me. I'm seeing me. I don't know if everyone else is seeing me like uh by the slide above Dr. Ajagbe to the
Yes,
left.
you,
Is
I see
everyone
you by
seeing me?
the side, by the side.
Yes, yes.
Okay, Auntie, you see, as you spoke now, I see you there. That had never happened before, so I don't know what's going on. Go ahead, sir. Well, we can see your slides.
All right, let me go. It's already timed out. Let me go back.
Okay.
All right, so the other thing that we need, so you're still seeing yourself, Dr. O, right?
Yes, go ahead.
Okay. All right. So the next thing that we do for preventive measure for children is applying sealants. These sealants are like very thin film, almost like nail polish. Similar to nail polish. We'll clean the tools that we want to apply the sealant to. Usually we'll clean it, polish it, and then prepare it for that sealant. When we cure the sealant, it's like a resin. We cure it with light and it stays there. I have seen patients that have their sealants for upwards of 20 years. That and that prevented their teeth from having any form of cavity whatsoever. So sealants for children, if it's done early before they already began to have cavities, can be very beneficial in terms of prevention of cavities or decay in their teeth. All right. Does everybody still see my screen or my slides?
Mhm.
Yes.
Yes.
So, the impact of sugar on oral health. I'm sure all of us have an idea, even if you don't know the details or mechanism of action. We know that sugary foods and beverages fuel bacteria that cause cavities. At some point in our existence, we have heard of that and we've learned it. Maybe not as a professional person, but at least you've heard it before. Almost every parent will tell their children, you need to brush your teeth if you're going to eat anything sweet. You have to make sure your teeth are clean so you don't get cavities. So acidic drinks also weaken in enamel because enamel is made of minerals, of calcium, and calcium, compounds can dissolve very easily in acidic environment. And everybody who is listening to me at some point during the day has an acidic environment in their mouth. And unless you neutralize it, the acidic environment continues. And it has, even though it may be very minimally observed, real time, but it has cumulative effects over time. Because many times people will say, I've been brushing, I've been doing this, but how come I have cavities in my teeth? Well, it's a cumulative thing. Cavities just don't come overnight. It goes on for years without being detected. Eventually, when the tooth caves in, then you can see a form of cavity. So any acidic drink that anybody is exposed to will weaken their teeth. And I may shock you, but if you drink a lot of Coca-Cola or Pepsi or any of those soda pops, if you look on the label, many of them have acidic components in it. And so there is no way, if you drink more than one bottle a day, that you won't have cumulative effect on your teeth. Even if you don't have cavity, you will have thinning of the enamel of your teeth over time. Sticky sweets like Tootsie Roll, like like chocolates that are milk chocolates, you know, snacks like Snickers bar, Mars, and things like that are very sticky, may stick to the teeth and remain there for bacteria to actually break down the sugary content to release acid, which is very injurious, not only to the enamel, but also to the gum tissue. So we should encourage children to drink water rather than drinking soda pops or sugary drinks, and to eat more nutrient rich snacks like vegetables. For children, I think celery sticks, and things that are very chewy are very beneficial to their jaw growth and development. So those are better options for the children than to be giving them sugary snacks that will eventually damage their teeth. So we all know that despite the awareness that children need um, prompt and proactive dental supervision, we know that there used to be, maybe there's still some discrepancies and disparities among the populations of children in America. Many children are from the underserved communities many times do not get the kind of coverage that many other children who are privileged do get. But in places like DC, California, and a few other states, the focus on the minorities and the underserved communities has heightened over the years. In fact, I can say categorically that children that are under Medicaid in DC are receiving the best oral health care in the United States. Because almost everything that pertains to children is covered 100%. So if a parent doesn't take their child that has such coverage for dental checkup, the problem is with the parent, not with the system. Now, there are states that still don't pay for dental coverage. They do pay some for children, but they don't pay a lot for adults. They don't. In some states, they don't even cover adults under Medicaid for dental. So, community health initiatives promote preventive care in underserved areas through health fairs, through outreaches, and school programs. Also all of these things can help children to receive prompt dental care. There's an increase in advocacy for better insurance reimbursement rates, which will encourage provider participation. Well, like I said, if you are practicing in places like DC, Washington, DC, or California, any part of California, you will attest to the fact that reimbursement rates seems to be a little on the higher side than many of the other states in the United States. So, the future of children's dental health. What we want to do now is just to peer into the future. So, what is going to happen with the oral health care of children? In order to increase the trajectory in the right direction, we need to increase emphasis on early detection and intervention, as well as preventive care. There are many advancements in dental technology that improve treatment outcomes. Now there are disclosing tablets or solutions that a child can use to rinse to show that the child has not been brushing properly. So if you have such a disclosing tablet or disclosing solution, you have a child to rinse first before they brush, and then when they brush, they come back to you to inspect. Everywhere they missed, will retain the stain of that disclosing agent. So that's something that is, even though it's very simple and is very affordable, yet is very effective in controlling how well the child can, maintain good oral health. Now, greater focus on addressing racial and socioeconomic disparities, that's always that seems to be in the front burner for a lot of counties and communities under the supervision of the state due to the federal government mandates for Medicaid oversight in the area of increasing or decreasing the disparities among groups in the community. Public policies supporting equitable access to dental care for all children. So that's the kind of thing that uh, Washington, D.C. Government is championing in many aspects because they do have school-based program where dentists are, invited to go screen children on school compound for all these early signs of uh, dental diseases, particularly cavities. And every child enrolled in any primary school up to to the 12th grade in DC, when they go for their dental checkup, they have to complete a form that they will submit to the school to show that, to give a brief history of their dental condition. So they will take it to school with the signature of the examining dentist, and the school will know when this child has any need to go back for checkup. The school will remind them that they need to come back, go back for their checkup and then come back with a report. So such public policies are important, and we need to see that, being practiced in many more constituencies, not just in few places in the United States of America. So, in conclusion and call to action, oral health is a critical part of overall well-being. We all know that. We've talked about that, many times on this program, and we have tied it with systemic health, oral health, and systemic health. We've tied the issue of oral microbiomes with the gut microbiomes. We've tied everything to show that the mouth is an integral part of the human body. And so there is no justification for separating the mouth from other parts of the body. However, the insurance policies have not changed. They have not changed since 1942. So there's still a lag in the insurance coverage, and we've talked about this in the past. And that's something that advocacy will have to be stepped up in order for something to change in the area of reimbursement of providers for providing cares to all the different population segments. Black pioneers have played a vital role in shaping dental care. We've alluded to that. So that's one of the things that we're concluding on, that though there was, you know, segregation, there was racial inequality and disparity in training, yet there were Black pioneers that were still impacting the foundation of the dental professionals in terms of training as well as practice. Parents, schools, and communities must promote health habits. So we cannot overemphasize that. For those who are still raising young children, it might be ideal for you to, propose to, PTA in your children's school to say that we need to have some kind of, presentations from the different professionals during the PTA, so that way everybody gets to learn the same thing and proactively improve the community's overall health habits. Advocacy is needed to improve policies and expand access to care. We cannot overemphasize that. That is imperative. And then a commitment to children's dental health ensures brighter future. That is the conclusion of this matter. We cannot ignore the future of these children by saying they are too young or their needs are not priority in many homes. So we need to encourage parents of young children up to high school level, up to 12th grade, to encourage their children to become proactive in taking care of their oral health. At this point, I want to say thank you for your attention. And if there's any question, any things that we need to further discuss, I'll be glad to entertain the comments. Thank you.
Thank you very much, Dr. Ajagbe. That was in depth. We didn't only get the, oh, by the way, if you please copy your information into the chat box, that would be great, so that people can access it regardless when the slides are down. Thank you. We did not just get the history of dentistry, which we needed to do February, since it's Dental History Month. You also talked about the importance of dental care. One thing that we have lacked, and that I know that Medical Mondays family have learned over time, is the importance of dental health to medicine. A lot of people separate them, but poor dental care, Dr. Jagbe, if you don't mind, I'm going to articulate this better, because you used some microbiomes and gut health and all of that. I'll just say that poor dental care affects all systems: your lungs, heart, brain, the digestive system. People have heart disease and even dementia is linked to poor dental health. When people have, cavities, they can then get that. Pregnancy is affected by poor dental health. That's why when women are pregnant, it is mandatory that they have to see a dentist, make sure that their dental care is up to par. Otherwise, it can lead to premature births and even low birth weights. The list goes on. Kidney disease, even, complications of diabetes and more. Arthritis. I can go on and on. So managing our dental health is very important. But as Dr. Jagbe, as you put in I think it was the second to the last slide, access to dental care is a problem, because especially of costs. Dental care is expensive, and a lot of insurances don't cover them. Like you rightfully said, even in some states, Medicaid does not cover dental health. And in states where they covered, some of them are limited care. Even commercial insurances have limited coverage. It will be just cleaning. You're allowed to clean your teeth twice a year. So what if you have cavities that need filling, or you need root canals and stuff like that? They become quite expensive. So what would you advise us as a population to do when people need dental care, or have toothache right now that needs to be dealt with? Because we see that toothache, I tell men who can't get pregnant, sorry, you can't, tell them that it's like childbirth. The pain is like childbirth. It's painful. So what would you advise in instances where cost is prohibitive?
Well, that, it's
The,
always,
the, the, the million-dollar question.
yeah, I was just going to say that the common adage of saying that there is no free lunch, it seems to be applicable in this case. Um, Everybody wants quality care. Everybody wants quality everything. The quality costs money. There is no shying away from that. Somebody must pick up the tab of any kind of quality care, right? Whether it is from a private practice or from a government-based clinics, somebody must pay the bills. So that's one of the reasons why it may not seem easy for anybody to just go around and think they will get free dental care. Now, if somebody has infection, well, you can go to any emergency room. If you have any swelling or severe toothache, you can go to any emergency room. At least they will give you antibiotics to reduce the burden of infection that is causing the severe pain. Now, if it is visible that there is a big cavity or there is a severe or acute or chronic gum disease that has an abscess, has all of these things, uh, you would not you that individual does not have a choice but to go see a dentist. Let the dentist take a look. No matter how expensive it may seem to that individual at that point, their life depends on it because any septicemia can go south so quickly. Once they get the pus and the bacteria loading into their bloodstream, it may be taking them in the direction of point of no return. So it is imperative that anyone who has infection, who has obvious reasons to have infection, that is, they have big cavity, they have broken teeth, they have anything that seemingly leads to infection of the mouth, should seek assistance. They should do whatever it needs to be done to get assistance. Now, we're not talking about cosmetic and all of that, so we're just talking about survival. Because anything that brings infection into the system will jeopardize all the systems of the body, like you said, Dr. O. All the systems of the body will be affected. So we don't want that to be the narrative of anybody that, oh, I have this toothache, but I couldn't go, the dentist didn't take me or whatever. So that should not be the narrative. Now, if you have any form of insurance, I think we tried to break this down a while back that the dental insurance, there are different categories of dental insurance, and everything depends on the premium that you pay. So if you buy any dental insurance, read the fine print. Ask them questions before you sign the dotted line. What would this thing, the insurance I'm buying, what would it get me when I need help? They will tell you the truth. They will tell you, okay, for regular, like you rightly said, Dr. O, for regular checkup and cleaning, we may be covered 100%. Okay, so you go in, you get a few x-rays, you get cleaning. If your cleaning is way, you haven't had cleaning in forever, and you have a lot of kicked up tartar buildup, you will not get regular cleaning under that circumstance. You cannot get regular cleaning. In such cases, you may have to be, the dentist will have to submit pre-authorization requests to the dental insurance to say, well, this is the state of this patient's mouth. He needs this type of cleaning, that type of cleaning, and the insurance will determine. Sorry. Hello? Dr. Duyebo, are you okay?
No, go ahead.
Okay. All right. So if the insurance determines that they are not going to pay for it 100%, they will tell the patient that, okay, this type of treatment, we will only pay 50% of it. So they will tell the patient upfront before the patient comes in that this is how much the insurance is going to pay. Sometimes the insurance will say, depending on the kind of insurance, you may have deductible that if you haven't paid the deductible, let's say your deductible for the year is 500, I don't care what you have done so far. If you have not paid up to $500 out of your pocket, the insurance will not pay a dime on any of your claims. So these are the things that you need to, anyone who is buying insurance should familiarize themselves with the terms of the insurance. If the terms are very straightforward, good. If the terms are not very straightforward, you need to ask questions. Now, major treatments, like, okay, let's say you have a badly broken down wisdom tooth. Wisdom tooth is way in the back. Most of the time is an oral surgeon that would do the extraction. A lot of general dentists too can do the extraction. However, the insurance may tell you that they're not going to pay 100% of that treatment. So now you are faced with a situation that you have to determine which one is important to you, to spend money on something else or to get rid of these bad tools that can cause you more grief. So the issue of insurance, I don't think we can overcome it. Since 1942, they have not increased. 1942 till this present, they have not increased the benefits in dental care. They increased the premium almost 1,000%, but they have not increased the benefits above what it used to be in 1942. So that's a big shame. And the lawmakers in Washington don't see anything wrong in that. And the insurance companies are getting away with that. So that's the way it is for now. Advocacy, like we said, will go a long way for increased reimbursements and also increased coverage for the patients.
Thank you very much. Appreciate that. I can't help but at this point just say that we Baltimoreans, or we Marylanders, I should say, because all of us will take the credit, have University of Maryland Dental School. I know that they actually care for a lot of my patients who can't afford dental care. I think they say the first patient who comes in every day for free. And so you see people get there waiting at 5 a.m. So they'll be that first person. And they're doing an awesome job. So thank you for sharing that history with us. And I just found out when you shared that we um, actually started the very first ever dental school
In,
or
yes.
dental care setting in Maryland. So that's fantastic. So if you have any questions, you can raise your hand and unmute to ask, or you can put it in the chat box. So, Dr. Jagwe, I have a question on this, and I don't know what is going on in the dental world. So maybe you can help us shed light into this. I'm seeing more and more patients, at least a couple a week, that are showing up with, you know, really bad dental infection of some sort. Their tooth is infected, they would have swelling, pain and swelling, So some of them would have abscess, right there on the gum, and uh, very painful. So as a primary care doctor, we don't suggest they go to the emergency room. We suggest that they come to us. We start them on antibiotics, on something for pain, and tell them to follow up with you ASAP. Because without them being on antibiotics and that starting, you are not going to be able to do anything for them. But what is going on that is different? Because I don't normally see so many, but I'm seeing a lot more.
Well, I can only presume on the fact that many of the patients that you're seeing may be non-compliant diabetic patients, particularly if you're having a lot of gum infections. They are the ones that don't, they still want to do what they want to do. They don't comply with your instructions. And more uh, stringently, they don't even do their regular oral health care. Some of them, when they come into your into your exam room, the smell changes from their breath because they are constantly bleeding from their gums and they don't know what else to do. They're embarrassed to go to the dentist. Many of them, I can tell you, if they are on Medicaid, you know, they do have some kind of coverage to allow them to come to the dental office for checkup. Even if they don't get to do bridges and crowns and all of that, at least for infections, they will be able to get care from a dental office. So that's all I can tell you. If their overall health is good, their immune system will be strong enough to battle against all these infections and they will heal easily. Do you know one of the problems of a non-compliant diabetic? Somebody who is uncontrolled diabetes will have poor healing with the environment of the mouth with increased sugar content in the blood seeping into their oral cavity. It's the heaven of bacteria, heaven of anaerobic bacteria, and they will destroy everything in sight. Hard tissue, soft tissue, everything. So that's the problem. Now, when I see such patients like you have rightfully described, as soon as they come into the operatory, the stench is on. You can't even ignore that stench. You already know that somebody's breath is fouled. So what I do for them before I even see them is to tell the assistant to give them peroxide, hydrogen peroxide to go brush with. You will not believe the transformation within few seconds of going to use the peroxide to brush their teeth. In the bathroom, they come back, no more bad breath. Amazingly transformed, incredible. So now what I do for them, those of them that have gone everywhere, they've not received any relief from their gum issues, even though they are still non-compliant as diabetics. Guess what I do for them? I tell them about baking soda and hydrogen peroxide. I ask them to come back in 2 weeks. Their life is transformed unbelievably. They come back, they say, how come nobody has told me this before? My grandmother used to say this, but we didn't do anymore. But now, thank you for telling me this. And they come back. The bleeding stops, the bad breath stops, but the healing is progressive. A few will say, now that I'm using baking soda and iron peroxide, my gum hurts more. My this hurts more. Those are people who don't want to be compliant. They think you are giving them too much hassle to improve their health. So I tell them, if you quit, you lose. If you don't quit, you will come back and say thank you. Because eventually you will see improvement once you begin to destroy all those anaerobic organisms and you'll be happier for it. And I can tell you, I have not had anyone that eventually after 2 weeks will tell me they will never use baking soda and hydrogen peroxide again. So when I was talking about the home care that they said toothbrush, brush your teeth twice with fluoride, toothpaste, and so on, I said we can leave that aside for now because that's what ADA approves. But let's talk from not just anecdotal, but my own clinical observation over the years. Personally, I use the same thing. I use the same regimen. I've been using it for over 20 years. So I have no complaint, and anything else is gravy. So I hope that will help your patient. If only you can just remember to tell them about baking soda and hydrogen peroxide before they even see anybody.
Ooh. Baking soda and hydrogen peroxide, a lot of us are using that now. Yes, I agree. But in your slide, like in the beginning, you did say something about toothpaste with fluoride.
Yes, I
You
may,
can
I
do
did,
that on
I
that one.
did, I did make a short disclaimer about that.
You did. I heard that too.
And that's why I said that is what is approved as the uh, standard of awareness information that ADA approves. You know what I'm saying? You do what they say. This is what the organization says to do. They standardize everything. They oversee the practice of dentistry. However, clinical observation also is very important. If you don't leverage your clinical observation, you will be punishing a lot of patients. If you see something that can benefit a patient and you don't tell them, you have not really served them much. I don't care what other things you try to do, but you know the particular methodology will work for them and you don't do it. It's almost like negligence. Although some people would now fight you and say, maybe it's anecdotal, maybe it's this, maybe it's that. Well, if longevity is evidence enough, even if it's one case report, and everybody approves that this change was objectively observed, it's scientific. So that means it's some kind of scientifically based observation. So now anyone who doesn't want to comply with that, it's okay. They have the choice to say no to treatment. So I tell them if you don't want to do it, it's fine. But since I've known that using any antiseptic or antibiotic mouthwash increases blood pressure, why would I give my patients that instruction again to be using the same thing that will increase their blood pressure? So for me, it's a no-brainer. Science already proven that using antibiotic mouthwash that destroys both good and bad antimicrobial, bacteria in the mouth will increase the blood pressure. I already know that. I would use that by telling my patient, if you are using mouthwash that contains alcohol, that contains chlorhexidine, if you are using it on a regular basis, stop. If you have blood pressure and the blood pressure is not being controlled, it's because of the mouthwash. If you stop the mouthwash and you use your medication, you will see an improvement. And if they see the improvement, who would they thank? They'll still come back and thank me, like, thank you so much. I never knew that the mouthwash I was using was actually killing me. Now, we're not fighting the war against those manufacturers. We're just talking about science. What has been observed? It's been observed very carefully that we need to populate the mouth with probiotics, oral probiotics. These are bacteria, healthy bacteria that will actually control the blood pressure. How that is happening, I already presented one presentation on this before, the use of probiotics in the mouth. What the good bacteria, the probiotic bacteria will do is they convert nitrates. The nitrates are present in our protein food. They convert nitrates into nitrite first, and then convert nitrite into nitric oxide. The nitric oxide is what we need to control our blood pressure. So if we don't have enough nitric oxide, which the mouth is the center for production of it, then our body will suffer for it. We will have non-elasticity of the blood vessels, and we will have high blood pressure, and will be uncontrollable even with all the medications.
Thank you. You're right. Baking soda and hydrogen peroxide is the way to go. And, I'm glad that you elaborated more on that. But we have a brother, a papa on the platform who is going through some of the things you have mentioned with diabetes and bleeding gum and need extraction and stuff like that. But he said, what if the baking soda and hydrogen peroxide gets into open hole cavity?
Open what now?
Open hole cavity.
You
When
mean?
you have cavity, you have a hole in your teeth, in your tooth, and
Mhm.
you're using baking soda and hydrogen peroxide, and they get into it. Of course, they'll get into it if you have cavity. So is asking
Mm.
what happens? Is that kosher or not? Is it okay or not?
Look, the cavity in your mouth is a cesspool of bacteria. And the worst kind of bacteria live inside that cesspool. I shared it before. Let me share it again. To understand what I'm saying, get a toothpick and start the inside of that cavity, start it properly and smell it, and tell me exactly what it smells like. It smells like latrine. No, I'm not exaggerating. This is the way it is. It's the same kind of bacteria, digestive and fermentation that causes those odor. And so if you smell it, you will know that the three bacteria we're talking about, that is their headquarters. So now what do you do? The mechanism of action of baking soda. You remember I said that everywhere in the mouth that bacteria resides, the bad bacteria always release acid. So the acidity of your mouth increases with poor oral hygiene. Baking soda is an alkali. It will neutralize the acid in the mouth. So if it neutralizes the acid in the mouth, it reduces the danger of the acid that is being released by the bacteria in breaking down the sugar in your food. So when that acidity is reduced, the bacteria's effectiveness is reduced as well. The peroxide is a second whammy on those bacteria. The acidity is reduced now, so it's now almost neutral. So they cannot fully thrive like they used to thrive in acidic compound environment. Now, when you now use peroxide, peroxide, hydrogen peroxide is a liquid that when it comes in contact with any organic tissue, whether it is plant or animal, it foams. It releases oxygen and water. The oxygen is your best friend in this situation. When it goes inside that tooth that has cavity, it cleans it up for you. All the anaerobic organisms that hate oxygen, they are paralyzed by the oxygen that is released by the peroxide. So now imagine the combination of baking soda and peroxide. You have neutralized all the effects of the bad bacteria in your mouth almost instantly. Now, I did not say to you that the baking soda is antibiotics. Neither did I tell you that peroxide is antibiotics. You understand what I'm saying? But their chemical reaction neutralizes the effects of all these bacteria that are dangerous for our oral environment. I hope that helps.
Thank you very much. So the short answer is that it is okay to use baking soda and peroxide. It does exactly what you like it to do to kill all of those bacteria that you don't want in your mouth. So having cavity is you would actually benefit from using baking soda and hydrogen peroxide. So that's the short of it. Thank you, Dr. Ajagbe. Dr. Izugu, kindly unmute and ask your question, please. Thank you.
Sure. Dr. Ajagbe, thank you again for detailed presentation and really underscoring the importance of proper dental hygiene, not only in many facets of healthcare. Could you especially with heart. Could you again re-emphasize the importance of routine dental cleaning? Not just waiting to when you have issue, but just going routinely to get dental cleaning for us to understand the vital importance of that, please.
Well, um, it is very, very important to have regular dental cleaning, checkup and cleaning, particularly if you are not doing a great job at home. The reason is the mouth, once you have infection in the mouth, it has access to every part of the body. One of the most vascularized places in the body is the mouth, particularly the floor of the mouth and the soft tissue that surrounds the gum, I mean the jawbone. So if somebody like Dr. O was describing, those patients that come into the office, they have all these infections. Just by having those infections, if they brushed, they have seeding of bacteria into their small blood vessels. And the small blood vessels merge with bigger ones, and eventually this bacteria circulates all over the body. And anyone who has a developmental abnormality of their heart is more likely to get a big problem because this bacteria will act as a small center for blood clot. And so for somebody who has valvular, problem, the underdevelopment, they can easily have these blood clots that will become uh, like missile being sent to every part of the body, including the brain, and this can cause tremendous amount of destruction all over the body, starting from the heart. So we call some a condition subacute bacterial endocarditis, which is a condition that the inner layer of the heart becomes inflamed. So, and that is not conducive for healthy living. So, if you go for regular dental checkup, the dentist is likely to discover something going on that he can propose a preventive measure before it gets to be out of hand. So dental checkup once every 6 months, it's okay. I mean, you can do much more than that if you have very bad dentition, for instance. If you have uncontrolled diabetes, it's better for you to go for more frequent checkups than to wait until you have real bad situation. I hope that answers your question, Dr. Izugu.
Yes, indeed. Yeah, thank you. Because again, that prevention is extremely important. And especially for many of our diabetic hypertensive patients with heart disease, or even have any heart murmur and stuff like that. Preventing these conditions are always way, way better than waiting till you get toothache, tooth infection, abscess, antibiotics, all that, and then valve infection and all that. So thanks again for that.
You're welcome.
Yeah.
And Dr. Zugu, make sure you eat that banana. You've not eaten, and you're still in the office. Eat.
Thank you.
Thank you very much. Thank you.
Dr. Zugu, eat.
Thanks,
I
my
will.
sister. I see the banana. See?
I will definitely do that. Thank you very
The
much.
banana is sitting there staring at me. I'm like,
And
what's
it,
up
and
with
it
that?
is. I didn't know. How did you see that?
I don't miss anything.
We're gonna get to munch the banana. Thank you.
Uh,
Oh, God.
just sit tight for 1 second. Technology is advancing and not
Yes.
necessarily um, mechanical type of technology. I'm talking in terms of technology in as relates to cutting edge interventions. One of the cutting-edge interventions I've already shared with us before. I'm going to share it again. And that is in the area of the use of oral probiotics. The oral probiotics is different from the gut probiotics. Of course, when you swallow, the oral probiotics will go into the guts, but that is not the main population of bacteria that the gut really needs. They are complementary. However, the mouth needs its own probiotics. So there are, manufacturers now that are coming up with some kind of probiotic candies that theoretically in the lab they work very well. Now, how it works in each individual, just like any other medication, uh, it's only through clinical trials that people, the scientists can document the outcomes of the use. But I believe that a time is coming that just using ordinary candy that is, actually compounded to combat the the bad bacteria in the mouth may become front runner, even much more than brushing and flossing and all of that. Because remember, if anything can dissolve in your mouth, it will interact with your saliva, and there's nowhere, no part of your mouth that will not be covered by that particular agent, whether it is food agent or medicinal agent, or even ordinary, chemicals in your mouth will go everywhere in the mouth. So the use of probiotics in the mouth is proving to be very effective, because what it does is it's actually, rather than really killing the bad bacteria, it competes with them. So when it competes with them, it's much stronger than the bad bacteria, and the bad bacteria becomes relegated to the background, because we still need the balance. The bad bacteria causes our body to stimulate certain things when our body is exposed to them in the tissue. So they modulate some of our immune system, immune chemicals production. So totally being devoid of the bad bacteria may not be to our advantage, but we need to have the good bacteria to outnumber the bad bacteria. So that's what I wanted to kind of share with you. I'm not selling anything, I'm not peddling anything, but I'm just trying to say there is movement in that direction.
Thank you. Dr. Aderonke, kindly unmute. Thank you. Welcome, sis.
Thank you. Thank you, Dr. Ajagbe. My question is, what if you don't have high blood pressure and you use antiseptic liquid just to gargle, not to swallow?
Technically speaking, nobody should swallow mouthwash. Nobody. I know the prisoners, they use it as their alcohol because they want to have alcohol in their system, but it should never be swallowed. If you gargle with it, you don't gargle without it being in your mouth. Do you understand? So the problem is not the mouthwash itself by themselves, but is the effect on the good bacteria that we are talking about. So it's not that you don't want to control the bad bacteria, but these mouthwashes don't discriminate. They kill any bacteria that comes inside. Do you understand? So if they are destroying the good bacteria as well as the bad bacteria, and it's affecting your blood pressure, then it behooves you to decide, I'm not going to take this thing anymore. And I've told this community before, if you dare to use the baking soda properly, you would no longer have any bad breath. And what do you use the mouth gargle for? It's because you want to control the breath coming out of you. So if you can brush your tongue thoroughly with baking soda, brush your teeth thoroughly with baking soda, and rinse with hydrogen peroxide, you would see the difference. You would tell me, in fact, you would be the one saying, I didn't know that my mouth could feel this way. And I've observed it even after eating, things that have sugar in it during the day. I do not have the same fermentation that I used to have before I started using baking soda. When you drink coffee in the morning, you say, I can't do without coffee. You brush your teeth, you drink. On your way to work, you go to Starbucks and you buy your special, uh, cup
Okay.
of, Starbucks coffee, and you're drinking all the way to work. The sugar in it, whatever sugar they put in it, goes to work with the bacteria. Bacteria starts breaking them down. Before lunch, if you don't talk to anybody, your mouth begins to ferment. The sugar in your mouth begins to ferment. You notice it when you start talking after a while. You say, wow, some people call it coffee breath. It's not just coffee breath, it's something that is going on. The bacteria are breaking down stuff in your mouth. So I will advise, if you know it's because of bad breath that you are using the mouthwash, use the baking soda properly. Just use it. And the way to use it properly is simple. Don't make it complicated. Wet your toothbrush. Get fresh baking soda each time. Don't go and mix some and say, I want to mix a batch and no, don't do that. Get fresh baking soda each time. Take it with your toothbrush. It will still be partially dry. It will not be fully wet. Use it to brush. It very lightly abrasive. It will not wear your teeth down long term. But caution, don't overdo it. Don't say because he says it won't wear my teeth, then you use, much more than you need. You don't need too much. What you want is the chemical reaction. You want the bacteria to see that there's something neutralizing the acid that they are releasing. And that's what baking soda does. Neutralizes the acid. The peroxide releases oxygen. I've said it a few times earlier. I'm repeating it for your understanding. The oxygen that is released from peroxide is what is, immobilizing the bacteria that are dangerous for your gums and for the teeth. So when they are immobilized, they can't function in that environment anymore. They may not die, but they do not function because they cannot multiply when there is oxygen. They can't. They have to be in totally dark area where there is no oxygen for them to multiply.
Can you dilute the hydrogen peroxide?
Why would you want to do that?
If you already, Doctor, if you already have 3%,
Hmm?
if the hydrogen peroxide that you are buying is 3%, you don't need to dilute it. But if it is 6%, yes, you should dilute it with 50% of water. So what you do is, if you let's say you do 2 tablespoons of hydrogen peroxide, then do 2 tablespoons of water. Mix them together if it is 6%. But if it is 3% solution of hydrogen peroxide, do not dilute it. But if you think it's too strong for you, yeah, you may add a little bit of water to it, but I don't think it will affect it too much.
My doctor
Last
there,
question.
a pharmacist. You're a pharmacist and she owns her practice. So she knows what she's talking about. I would suggest just the 3% and not diluting because if you notice, the hydrogen peroxide comes in this dark container. There's a reason why it comes in there. It's so it doesn't break down into water and oxygen that it would easily break down into. You want that breaking down to occur in your mouth. And we talked about this before on Medical Mondays with Dr. O, when Dr. Ajagbe shared that in Nigeria, he bought hydrogen peroxide and it didn't foam. So it was something else in the container. Definitely not hydrogen peroxide.
It was
So,
just water.
okay, so it would foam. And then you want that foaming to occur in your mouth. You want the breakdown to occur in your mouth because that's what you need, the oxygen to take care of those anaerobes. So
Okay.
I would suggest the 3%, and you can handle it. It's not bad.
Okay, my last question. There's some toothpaste that have this sign ADA, American Dental Association, like kind of an approval. Why would they approve that by dental association, by supposedly people that knows better? Supposedly.
We're not judging anybody here now. This is not a tribunal. So what I will say to you is this. Whatever an association approves must have been based on some kind of studies. They don't just approve something because they want to approve it. There will be a series of studies that will say whether it is in clinical setting or in animal studies or in petri dishes, they will say that this particular thing, just like we're talking about baking soda and hydrogen peroxide, if you do the same kind of experiment and say this works 100% of the times compared to another one, then you say this one is more efficacious than that one, right? So they do not just willy-nilly label approval to anything. Remember, manufacturers, they want to continue to make money. So they will do whatever they must do to leverage, the organizations to get approval. So for instance, they will say, we're going to fund your research for this, we're going to fund your this for that. And then, of course, hand wash, the two hands washing each other will make things happen. Now, if another researcher comes up and say it is dangerous, what has been approved is dangerous. For instance, some people are fighting the fluoride content in toothpaste. Some people are fighting the triclosan that is present in the toothpaste. Some people are fighting the fine abrasive, silicon dioxide that is present in the toothpaste. Some people are fighting the pigment in the toothpaste. Some people are fighting the sweetener that they use in sweetening the toothpaste. So a whole lot of fights are coming up from different angles. And everyone that is raising up advocacy in that direction is saying there are specific, either anecdotal or research that supports their point of view. So ADA does what it thinks is okay within the purview of their function and charter. They look at what is available in literature and say, hey, there are many articles in the literature that support triclosan as being good in preventing caries, for instance. So if they say it's preventing caries, the goal is to prevent caries, right? Now, if somebody who did that experiment didn't look at the adverse effect of triclosan say for instance, in blood pressure, the effect of triclosan on blood pressure or diabetes, somebody else does the experiment and say, hey, wait a minute, guys, this triclosan is bad. Well, the manufacturers might want to fight, but when they see the result, they will say, oh, the result speaks for itself. Then we can't do anything about it. They will not begin to take away triclosan from their product slowly, but they cannot take it off just like that because of their investment. The reason I'm saying this to you is because I've worked closely with Colgate in the past. So I worked with them and I know exactly how things have transpired. Even when we do research and we give them and they see the validity of the result, it takes years for them to change their current operation to the new one. The same thing with NIH. NIH doesn't change things overnight. The NLB has so many articles, publications that are not even touched. by clinicians at all that could change the practice of medicine, because people, it's too much. There's too much information.
Yeah, but beyond too much information, I think there is wisdom in the waiting, in the stalling. In medicine, what usually happens is somebody does the research, finds something. We usually like to see other people duplicate the research and see if they get consistent result before it becomes something that is taken on. So that's another subject that, it's a big
Yeah.
subject of debate.
Mhm.
But is your question answered?
Thank you.
Thank you. So
Thank you, Dr. Ajagbe.
I have thank you. I have a question here that says, does baking soda increase blood pressure, Dr. Ajagbe?
I don't see how baking soda can increase blood pressure.
Okay, great. So it doesn't.
It doesn't. Yeah.
Dr. Alu, it doesn't increase blood pressure. It's the
There is no study that links baking soda to increase in blood pressure anywhere.
okay.
It's not. It doesn't do the same work as chloride, sodium chloride. It is not chloride. It is sodium bicarbonate.
That's true.
Carbonate is different from chloride. Chloride is what goes into the bloodstream and increases osmolarity, that is, increases the absorption of what the movement of water into the blood vessel. If you have high blood content of chloride and sodium, water will move into that vessel. So that's the reason there's hypervolemia that comes from too much sugar, too much salt in the bloodstream. Anyway, so baking soda, it does not work the same way as sodium chloride.
Okay, so it doesn't increase blood pressure. Thank you. Another question says, can peroxide be used daily? Also, what are recommended prebiotics? So that's another subject, but can peroxide be used daily? Second question, what are recommended prebiotics?
Well, okay. Personally, I've been using baking soda and hydrogen peroxide for 20 years. So I use it every day. So if I don't have any adverse reactions from it, and I don't remember the last time I ever had bleeding from my gums. Now, remember, bleeding from the gums does not respect your profession. It doesn't care whether you're a dentist or a surgeon. You will have gum disease if you don't take care the way you should. But my experience with baking soda and hydrogen peroxide is that it neutralizes everything that could damage the tissues in your mouth. So you could use it every day. If you want, you can use it twice a day. Sometimes I use the peroxide by itself, maybe twice. Let's say I've just eaten, things like boiled egg and all of that stuff. I may just choose. If I don't have a toothbrush with me, I can just use a swig of peroxide. It will neutralize whatever else is going to, sulfonic gases that will be released from the egg. It will neutralize that. So I use it every day. But everybody has prerogative of choosing how frequently they want to do anything. But using it every day is not dangerous.
Thank you so much. I'm sure that question is answered. I don't have any more questions for me. You did an excellent job. Are there any other questions? Okay. Thank you also, Dr. Jagwe, for elaborating on childcare, children's oral health. I have seen some bad deals. Rotten teeth in children, and it's disheartening. So thank you for focusing on that a bit tonight and encouraging good oral health. It's important that children also brush their teeth twice daily. I saw that in that slide, and I'm like, I already wrote down the question before I saw this slide. So thank you for that. I think take home message in that aspect for our children and grandchildren. A lot of us as grandchildren, we have grandchildren already. Take home message is to make sure that their oral health is excellent, to set them off.
Can I say something?
Yes, please.
Yeah.
Well, I was going to say to set them up for excellent health going forward. Go ahead.
Thank you, Dr. Ajagbe. That was good as usual. You know what some people do? They put the kid to sleep with the bottle, and those kids come up. I forgot there's a name you call. Most of the teeth have to be extracted.
It's called,
Avoid putting the child to sleep with milk, something I think it's called.
it is called feeding bottle caries.
Yeah, okay.
And we also call it rampant caries. You remember when I was presenting, I said sometimes because of the weakness of the teeth, of the baby teeth, some children can have multiple decayed teeth at the same time. And so when you see it in the front and in the back, they will be in pain. Go ahead.
Yeah, because those kids come, there was a Friday when the dentists were there. You would have about 6 kids coming, all the teeth in the front are rotten. It's horrible to see. And so we must emphasize that. Do not put the child to sleep with the bottle. Thank you.
Yeah,
Thank you so much for that input. Yeah.
Dr.
Please,
Vic.
Dr. Ajagbe, before you answer, add please pacifiers to that.
Yes, that's what I was about
Thank
to.
you.
Okay, so some of the habits of the parents are usually based on ignorance of how things really happen. For instance, what Dr. Buka just shared with us, babies are being put to bed, not just with their, baby bottle with milk, but they put soda pop, uh, you know, um, this, whether it is, I don't know, I can't remember the name of the orange colored, soda that's, whether it's Crush or Fanta or something like that. They will put it in the baby bottle because it's sweet. They believe that anything that is sweet will make the baby quiet. And sometimes the baby will sleep with the baby bottle in their mouths with sugar everywhere. And to make things worse, when the baby bottle drops to the ground, the mother, instead of taking it to go and rinse, the mother will wipe it and suck the nipple for the baby as though they are cleaning it for the baby. They do not realize that they are infecting their baby with very virulent microorganisms from their own mouth. So now, a mother who has bad, oral hygiene, sucking the baby's bottle, nipple, and putting it back in the baby's mouth has just cultured the bacteria from her own mouth in that baby's mouth. So, what do you expect? It's going to be more virulent. When I use virulent, much more dangerous effect is what is going to happen in the little child's mouth, and that's why the baby teeth become so rotten so quickly for some babies. And due to the socioeconomic disparity, we know that the children that come with such situations are children of people who are in the low economic status class.
So,
The same thing
Dr.
with
Ajagbe.
pacifier. The same thing with pacifier. Some of them will dip it in Kool-Aid. They will dip it in soda pop and shove it in the child's mouth. The same thing when they wipe it, if it drops from the baby's mouth, they pick it up, they wipe it on their dress, and they put it in their own mouth, and then put it back in the baby's mouth. All of this, even for a baby that doesn't have any teeth yet, they are cultivating an environment for very bad bacteria in the mouth of that little child.
Thank you. It's not just bacteria, though. What about herpes type 1?
Yeah, I mean, all those.
Cold sores.
Mhm,
70% of the world today have cold sores,
mhm.
including children in that 70%. How? Same way. And that's why when I see adults kissing babies also, I'm like, stop. Don't, don't kiss that baby. Because a lot of people have herpes, which we call cold sores. When people have immunities that dwindle, their immunity is down, and they have, cold or something, which you call cold, or a upper respiratory infection, they would develop these sores. It can be under the nose, on top of the lips, at the, wherever on the lip, or even underneath the lip. And they say they have cold sore. It's herpes. So it's
Yeah.
very infectious. The problem is a lot of people that have herpes don't even know they have it if they've never had a breakout. So, but they have periods every month where they shed the virus. So anyone you kiss then, any pacifier that is soaked at that time, they directly inoculating the person,
Yes.
transferring the
Yeah.
virus to that person. And that virus herpes lays dormant in the nerve cells until immunity is down and then the person breaks out. So it's a very, very bad habit.
Yeah. Thank you, Doctor, O, for mentioning other organisms. Yes, it is true. Not just bacterial infection, fungal infections, viral infections are transmitted to children. In fact, we used to say that uh, candida infection, that is yeast infection, is the infection of the two extreme of life, babies and elderly. You see, because of their immune status, as not as strong as those who are still in their active adult stage. So what's going on here is, if a mother who is who has a very bad lifestyle, whether they are drug users, cocaine users, marijuana smokers, and all of these things that can actually easily be transferred to the children, are constantly putting things from their own mouths into the baby's mouth. They are actually getting that child exposed to dangerous stuff. And it's a very, it's sad, but that's all they know, unless there's awareness. And some of them would think they are the best. In fact, that they can even assume the risk of sucking something that dropped to the floor on behalf of their child. They think they are doing a great job. Unfortunately, they are complicating the matter. They're picking what is on the ground, putting it in their own mouth, putting it in the baby's mouth. That is multiple exposure. And that is not nice. It's not something that we should encourage. Anybody that we see doing that, we should politely, if they want to listen, advise them that that is not helpful to your child. In fact, I believe that giving a baby pacifier is one of the most dangerous things that any parent will be doing, because it doesn't cause the jaw to develop properly.
Yeah, that's another topic.
So,
So I have a question.
mhm.
Can we discuss the effect of chewing gums on the teeth?
Well, okay. The chewing gum, first of all, if we can call it non-nutritive habit, because the chewing gum is not something you chew and swallow, so it's non-nutritive. So it's a habit, just like you're chewing stick, you're chewing straw, you're chewing anything that some people chew, even metallic stuff, like paper clip. People chew all kinds of stuff, all in the name of, yeah, I'm just used to it. I don't know. People who chew gums, they chew gum primarily because of breath. They want to improve their breath, their mouth odor, because of the mint that is present in the chewing gum. They believe is going to improve their breath when they are talking with other people. I would say that, like any other part of the body, if you overuse any part of your body, it will wear down faster than if you use it under normal circumstances. People who chew gum will eventually, that is, they can't do without chewing gum. Their temporalis muscle will overdevelop. Okay, so you see the muscles of their on the side of their forehead being bigger. That is hypertrophy of the muscle. That's one effect of regular chewing of chewing gum. Also, the masseter, the cheek muscle, the jaw muscles on the side of the face, below the ears, they too can become very enlarged because of the chewing over time. It is not hereditary that people's jaw will be like that, but sometimes it's just because of the habit. The worst that could happen for somebody who chews gum relentlessly is the wearing down of the teeth. The teeth become shorter over time. And once the teeth become shorter, it affects the TM joints. I don't know if everybody is seeing me, see my video. I can't see myself. Let's see if I move this. Maybe I can see myself. Okay. So if you keep grinding your teeth, whether you are grinding your teeth based on chewing gum or in the night, your teeth will become shorter over time. And then that means your jaw, when you want to close your teeth together, your lower jaw will travel farther than before. And that causes an effect on your TM joint, that is the joint of the jaws right here, which is right in front of your ear on either side of your head. So if that continues, some people may complain of severe headaches. Some may complain of clicking of their joints, and some will actually have um, difficulty, with talking. I don't think you want to wait until that happens before you start wondering whether it has to do with the chewing gum. Anything that is not done moderately is bad. We can still chew gum. I still chew gum occasionally, but I haven't chewed gum in about 10 years. But if I have to chew gum now, I won't have any problem chewing gum. But I know some people cannot do without chewing almost a pack of chewing gum in a day. That is too much. That is not necessary. If you are concerned about your breath, try the baking soda and hydrogen peroxide and try for 2 weeks and see what happens. If you don't like it, well, you have the option of leaving it alone, but I can assure you, you will like it. I'm not selling baking soda, I'm not selling peroxide. So I'm not trying to push something for my own material gain. I'm just saying what I've used that has worked for me. Other people that have prescribed it to have used and it's worked for them. I think you owe it to yourself if you think your bad breath is the reason you have to engage in some habits that will eventually harm you long term. Thank you.
Thank you, Dr. Jagwe. You talked about chewing. What about chewing bone?
What?
Bone,
Okay.
like the bone of fish, the bone of meat, when we eat.
Mhm.
We Africans love to enjoy that chewing after eating the flesh,
Mm.
to enjoy the bone. What about that? Does it
Well, I
adversely affect the teeth?
You mean gristles?
Do you call it gristles?
talking about cartilage. That's what
Yeah.
it's.
Yeah, okay, the cartilage, yes, also, but you know the bone, the bone of, say, bone of chicken, bone of fish, when you finish it, when you eat the flesh and you just enjoy that bone, because you know those sauces go straight into the bone and you can suck it and eat it. Also meat is what I'm talking about. Does it affect your teeth?
I think what you're describing is more of cultural norm. Yes, there is nothing wrong in chewing anything, but if you try to crush something that is stronger than your teeth at that particular point in exposing yourself to uh, mechanical failure of your tooth. If it's not more than one tooth, at least one tooth that is weaker in the in the process of trying to crush the bone will fail mechanically. And what that means is it can chip off or it can split into two. Now, the way the teeth are formed naturally, you see in the middle, if you look on the back, the teeth that you really use to chew the bone, it has like a valley, like you have four mountains, and then you have valley in between them. That valley is a very weak spot. I don't care how strong your teeth are. That valley, when anything too hard engages that valley, it acts as a vice as well as a wedge. I don't know how many people have split wood before. If you have used axe to split the wood, or you've used a peg to split a wood, you will understand the point I'm trying to make. You make a small hole, and then you put the peg in and start hitting the peg. At some point, the wood will split. You don't even have to use too much force. Just by tapping the peg, particularly if it's a metal peg, you will split that wood. The same thing with your tooth. If you keep chewing bone and occasionally you have a small, you don't want some tiny bones that you think you can easily crush, you can't crush them. If they get wedged into this valley that I'm talking about and you can't get them out, it stays there. You chew another bone and it lodges around that, it creates a wedge. On the long run, you will split that tooth. I don't care how long it takes, the tooth will split. And when it splits, it may be something very trivial. It may just be the softest part of the bone of chicken that you just try to crush. And that will be the last straw that breaks the camel's back. You will split that tooth and you'll be in severe pain. I would not ask anybody not to chew bone. Chew with common sense. I mean, if I can use that term, common sense. Just use, just use wisdom in what you chew. Some people believe they can crush any bone in this world. Well, be careful because I've had many patients during the course of my practice that all that broke their teeth is bone. And they may find somebody with about four teeth broken on the same side because they were trying to crush one particular bone. And the teeth will fail. And once the teeth fail, they can't even chew any more bone. So that's why I said, let's use wisdom when we say we can't do without chewing bone. If it's too hard, just toss it. Leave the battle for another time, Don't engage yourself with a battle that you will lose. Just choose your battle wisely. That's what I will advise. I enjoy the bone marrow in chicken bone if it's soft enough. I don't have to crack every bone in this world because I already know the downside of it. It can crack my tooth. And if it cracks my tooth, I'm the one to be in pain, not the bone. So I use wisdom.
Thank you. Thank you so much. So, can you give us your parting words?
Well, I think the dialogue continues, and everyone will continue to remember something after the Medical Mondays with Dr. O is over. Say, I wish I asked that question. Okay. If you do, don't worry. There will be other opportunities for you to ask the question. One thing is very clear. We know that the pioneers, the African American pioneers, despite the segregation, despite the all the problems that they faced in this world, they still have made major impact. They paved the way for us. Because if they didn't do anything, if they kept on complaining, because I'm a slave, my father was a slave, everybody was a slave, they didn't give us chance, and they didn't study, we will not have the opportunity of learning from whatever they laid down many years ago, and now we are able to help other generations coming behind us. So I want to say thank you to our forerunners in this profession. I want to say without them, I would not be here. I would not be able to talk like this or share anything because it is on their um, shoulders I'm standing and I'm able to at least be able to say I'm a professional. I receive excellent training both in Africa as well as in America. Because if segregation still continued during my own time of going to school, I would not be able to get such education because of such disadvantage. So that's one major parting word. We cannot overemphasize the importance of monitoring children, whether they are our children, direct children, or grandchildren or great grandchildren. Their future or their futures are important to us. Uh, One area that I didn't talk much about because it doesn't have a direct relation in that sense to what we're talking about today is breastfeeding. That's one area I will have emphasized a lot.
The
Uh,
next time we'll bring it. Shelby, you're coming back next
yeah.
month. No, I can
So,
find a way to squeeze you in.
so,
We can do
so,
that.
so breastfeeding for those who are nursing mothers, the best gift you can give to your baby is breastfeeding. I don't care what obstacles you may face in doing that. If you can overcome the obstacles and breastfeed your child, it will save you a lot of money in the future. If the baby's jaw, upper and lower jaws are formed perfectly well, and the tongue is not tied to the floor, and the floor of the nose is not pushed up, and the nose is not compressed, that baby will grow up to be a healthy child and healthy adult that will not need braces, will not have cavities, because you have have laid down the best foundation for that child. We are fortunate for those of us who grew up in Africa, who were forced to choose sticks when we were growing up. That was one of the reasons why many of our jaws developed properly. Even then, some of us still have crowded teeth. Even though we had opportunity to choose sticks, the chewing stick was one of the game changers that our forefathers passed on to us, but we lost it because of marketing of toothbrush and toothpaste. So now we are having more children in Africa with crowded teeth that need braces. So we lose some, we gain some. So the bottom line is this: breastfeed your baby, transition them from breast milk, if you can, to adult food.
Mhm.
I started my children with chicken bone, the long chicken bone that cannot break into their throat or choke them or anything like that when they're beginning to teeth. When they start salivating and I give them chicken bone. I gave them chicken bone, and then They learn how to enjoy adult food, and from that point on, they don't have to do anything. We did some GABA product. Let me not lie about that. We did some. We did our own product at home, milling some rice, cooked rice, and grinding it down to make it into mush. But that's not the best way to go. Please, if you are raising children now, do not go from milk into mush. Go from milk to adult food. Let them begin to start to chew stuff. Give them something that will not choke them, they can chew on. And it stimulates the growth of their upper jaw, which affects the nose, which affects the sinuses, which affects the airway, which also affects the tongue. Because all of this combined together, if they are badly formed, bad news. So that would be the end of my take home thing. If you need more specific information, I've already given Dr. O a PDF document on take home message for this presentation. And
Thank
if
you
you have
very
my
much.
contact, I've already sent you that same thing before the presentation. So you have something to fall back on.
Yeah, that's true. And I sent it to you. Everyone on text messaging, I will send by email ASAP. And I have Dr. Ajagbe's information reposted in the chat box. So if you need to contact him for teeth health or tooth health or oral
All right.
health, um,
Enter
his
whichever one.
his information is on there and you can reach him on WhatsApp. Thank you so much for.
Hi,
Hi.
I have a question for Dr. Ajagbe, and if you don't mind.
Oh, go ahead, ma'am.
Thank you so very much, Dr. O, and thank you, Dr. Ajagbe.
Well,
Your some young folks are here with me, and they overheard our conversation. And the question is that the best thing you do is breastfeed. And what they were saying is that maybe there should be a qualifier for that. That because they were arguing, we are really arguing here, that not everybody can breastfeed. And when we older folks say you should be able to breastfeed, it's hurting those people because we don't understand that they have medical conditions. And so what they're saying is, if we're saying breastfeed, we should be considerate maybe to qualify it that if you do have, or some people might not be able to breastfeed because of medical conditions. That's your question.
Yes. Dr. Ajagbe, you want to answer that or you want me to tackle it?
thank you for bringing that up. The goal of this presentation, or my allusion to that, is not to castigate anybody or to condemn anyone who is not able to.
Thank you.
I qualified it by saying the best gift you could give to your baby is breastfeeding. That's all.
If
You can't, for any reason, that's okay. It's understandable. You can't. It's not like if you can do it, you choose not to do it. That's what I'm saying.
Okay.
You know to do it, and you choose not to do it for any other reason other than medical condition that precludes you from doing it, then you are not doing your child a favor. You will pay for it in the long run if the jaw is not well formed. You will be the one worried about the child snoring through the night or stopping to breathe with sleep apnea very early. That person will be the one worried about the child having air infection all the time, having sinus infection all the time, having nasal blockage all the time, having mouth breathing all the time, even having asthma. On top of all of these things and severe allergies with tonsillitis and adenitis. Now think about it. If you're going for the doctor's visit for each of those ailments, how much is it going to cost you? And how painful is it going to be to a parent watching the child suffer? I cannot overemphasize this. If you can't breastfeed, so be it. If you can't breastfeed, you can't breastfeed. But if you can, there is no justification for you not to do it for your baby. Because you will, in fact, you'll be so happy you did. Because that child not only will be bonded to you, that's psychologically, but the jaws, the upper jaw, the lower jaw, the tongue, the nose, the airway will develop so well that they will not have any of these complications that we talk about. Can you imagine a child that has sleep apnea that's already having high blood pressure? How do you deal with that? How much medication do you want to give to a baby because of the underdeveloped jaws? And I cannot, in fact, can stand on my soapbox for 2 hours talking to everybody about just making sure you help your child to have a head start. That's the only head start I can tell any parent to give to their babies. Give them good head start. Let their jaws be developed properly. If they develop properly, they will not have speech problem. They will not have self-esteem problem. They will not have crowded teeth. They will not have tongue tie. They will not have. Look, I apologize for any mother, any young mother who thinks she's being castigated because she can't breastfeed. If there are alternatives, do it. I mean, I don't understand. I mean, there are specialists who can help you to overcome such hurdle. But from my own standpoint, I would say whatever you can do to limit anything that would prevent your child from developing normally, you will do it.
Thank you very much. I'll be interested, Auntie, in knowing what my folks there, my nieces there, what they consider medical problems that one should not breastfeed with. We don't have too many of them. People who are on drugs like cocaine, heroin, and stuff like that. We don't encourage breastfeeding because we don't want them transferring these drugs through breast milk to the baby. In fact, most of them are at that point, if they're still actively using, not that responsible anyway
Exactly.
to breastfeed. There are, certain genetic conditions, but they're rare. HIV, we encourage women with HIV in Africa. We encourage them to breastfeed, and especially when we've treated them to goal. And what is the goal? We treat their viruses to less than 20 in the system. So we suppress the virus and they breastfeed, they don't transmit HIV. With good support, most women can breastfeed. So I am not apologizing because it is my area, it is my field, it is what I do every day. I think what Dr. Ajagbe is saying is that women who deliberately choose not to breastfeed. I've seen women who choose not to breastfeed because they say they don't want their breasts to become slabby. Those are the people we're talking about, that please don't take flabby breast or firm breasts over breastfeeding your baby. When you finish, if I'm talking to women who have that mindset right now, when they finish breastfeeding, they don't want, they've had all the children they want. We have plastics, we have surgery now that would firm up the breast. It's a thing now. But women who have had breast surgeries actually before they start having children may not be able to breastfeed.
Absolutely.
So
Yeah. Absolutely.
one has to take each situation individually And that's why I said with good support, most women can breastfeed. There are other conditions, like for instance, let me give another one more, and there are a few more. Say somebody develops herpes on the breast, or did I say herpes? Varicella zoster.
Yeah, it's still shingles, it's still herpes.
Yes, on the breast or around the breast. We don't want them to breastfeed the baby during that time because they have that infection. We don't want it passed on to the baby. Active herpes lesions around the breast or on the breast, we don't want them to breastfeed. So things like that, or a mother has TB, tuberculosis. It has nothing to do with the breast, but we don't want them to breastfeed. Again, one has to take each woman individually, but most women can breastfeed.
Yeah, and people that have abscess in their breast should never
Cannot. Mhm,
breastfeed their baby. Apart from the fact that they will have pain from the abscess. So if they have cancer, they cannot breastfeed, the baby. So those are exceptions, to the rule. But what we're advocating is all these things that we're talking about might be prevented proactively by doing some natural things, like breastfeeding. If a baby is breastfed and the jaw develops properly, and the mother becomes slack, doesn't inspect or doesn't supervise the baby's oral hygiene, and the baby still take a lot of sugar and all these things, they can still have cavities. So it's not like once the jaw is fully formed, that's all the mother's job is over. No, there is just that the foundation will be laid very well. Now, if somebody has a challenge to breastfeed, they should seek help. If they can get help to do it, they'll be grateful in the long run that they did. But let them not just feel overwhelmed or feeling ostracized, just by the thought that people are labeling them as irresponsible or whatever. That's not what we're trying to do here.
Yeah.
Just
Um, health benefits of mothers who breastfeed their children are tremendous. They're enormous.
yes.
One thing I'll tell you, it gives them more rest because they don't have to, be washing bottles and all of that. When you just have a baby, it's not easy. Babies, you sleep when baby sleeps and stuff like that. Any little thing you don't have to do is helpful. So when you're breastfeeding, you don't have to worry about those things. Another thing is, on the long run, long term, this breastfeeding actually has been linked to decreased breast cancer
Yep.
on the long term. So it's best to breastfeed because, that's a health benefit. Um, I've also seen that it helps women lose weight, you know. Um, for the baby, though, let's talk about the baby also. It's important to note that research has shown that the longer you breastfeed your child, breastfeeding them over 1 year old, increases their IQ.
Mm-hmm.
So babies too, babies get, if their immunity is built better than formula-fed baby when they breastfed. So there are lots of advantages.
And they have less allergies.
Yes.
Mm.
Thank you so very much, everyone. So till we meet next week, please stay safe. Even if you have gotten flu vaccine, we're seeing a lot of flu. I'm seeing a lot in people who have been vaccinated with the influenza virus vaccine this year. So I want to ask that you please keep safe. Mask. I'm asking for my patients at clinic to mask up again. When I go in, I want them to mask up because we don't want infection. Dr. Veronica, you have your hand raised.
Yes, thank you, Dr. O, for calling on me. Good evening, everyone. Dr. O, thank you for another great evening. Dr. Ajagbe, you always rock it. You have such really solid examples of your own experiences. That's very helpful. But I also wanted to not just thank both of you for a great night. Dr. Zugu, thank you, sir. I hope you ate the banana.
You have to be on his case. It's got
But
to eat.
Doctor, oh, sorry, on your behalf, if your friends have gathered to kind of come together to form a committee of friends to support Dr. O on the passing of her husband's homegoing. So I posted it in the chat room. Please, if you can join us and you can invite other friends, just forward the link to join us as we put together any support we can give to Dr. O as the homegoing of the husband. May his soul also rest in perfect peace, and may God console Dr. O and her family. Thank you, and thank you, Dr. O, for all that you do. Thank you. My phone number is there. You can also text me on WhatsApp if you have any questions. Thank you, and Mr. Tekoja, thank you for joining me to do this.
Thank you. Thank you so much. Thank you, Diola. I appreciate you all, everybody. Thank you.
Thank
I
you.
love
Thank
you.
you.
And I
We
thank
love you.
everyone that has come to see me, the text messages. If I've not returned your text message, please forgive me. I will. Trust me. I just have a lot of them. And phone calls, I'm sorry. When I have people in the house, it's hard to pick up the phone, but I will respond eventually. Text messages, I guarantee. To phone calls, forgive me if I don't get to respond. Thank you.
So, Dr.
Yes, sir.
Two things.
Yes.
I just want to tell everybody, if you go to the group, if you go to the chat, you can just click the link and click join. If you want to join, you can do it
Yes.
right away.
Yes. Thank
So
you.
you have this invitation to join the link. So just go ahead and join. Dr. O, the other thing I wanted to mention is this, believe it or not, next Monday is public holiday, President's Day.
But we don't observe President's Day.
I'm just saying, so just for you to know. So if you don't,
It's the third Wednesday,
okay.
one, and we have never observed President's Day, have we? No.
Well, the state government is closing, so the MVA will not open on Monday, and I think some banks will not open too. But anyway, it's just to bring that up to you.
Well, that's good. If they don't open, it means that we'll make it to Medical Mondays and we'll make it on time.
All right, cool.
We have a cardiologist coming from the Johns Hopkins to talk to us about this important arrhythmia, irregular heartbeat. It's cardiovascular month. It's very important that we know. I'm glad we're not off yet. Dr. Jagwe, we talked about oral health. Oral health also, if it's poor, can cause increased stroke, clotting, stuff like that. So this irregular heartbeat that can occur anytime can also potentially cause clotting, a lot of bad things. So we're excited that it's coming. And we never observe President's Day. We will pray for the president next week. We'll remember to do that. Then Dr. Jagbe, make sure you remind us.
Okay.
So we pray for our nation for like 5 minutes. But we'll be here.
Cool.
Thank you.
Thank you so much.
Thank you, everyone.
Good night, everybody. Good night.
Good night. Well done. Thank you.
Good
Dr.
night.
O,
Awesome,
thank
Dr.
you.
Ajagbe. Awesome.
Thank you.
God bless you, Dr. O.
Dr. Ajagbe.